आणि कॅन्सस सिटी ऑलमोस्ट 5 to 6 गेम्स होस्ट करते. सो आपल्यातले बरेच जण गेम बघायला जाणार पण असतील. सो हे पुढचे 2-3 महिने बेसिकली आपण सर्वांनी काय आणि विशेष काळजी घेतली पाहिजे हे आजच्या सेशनमध्ये जाणून घेऊया डॉक्टर बालांकडून. अँड जस्ट टू गिव्ह यू हेड्स अप, हे सेशन आपलं इंग्लिशमध्ये असणार आहे. सो ब्रीफली अबाउट डॉक्टर बाला. So Dr. Bala Somayaji, MD, on medical degree and post-graduation in anesthesiology from MKCG Medical College, Behrampur, and was practicing anesthesiologist in Southeastern Railway, Vizag. She pursued her internal medicine residency in Chattanooga, Tennessee, and subspecialization in infectious disease at University of Kansas Medical Center, and practicing in Kansas City for almost last 20 years as infectious disease specialist. She lives in Orland Park, Kansas with her husband and is a proud mother of a physician daughter and promoted to the grandmother title 3 months ago. Dr. Bala will educate the community on infectious disease, its role in disease management, while also shedding some light on the spread of hantavirus, Ebola, and measles. As thousands gather to celebrate the world's biggest sporting event, learn how infectious disease awareness and public health preparedness to help Kansas City safe and healthy. So join us for conversation with Dr. Bala Somayaji on infectious disease awareness and community health during the FIFA World Cup. Over to you, Dr. Bala.
Okay, thank you. And thanks for the nice introduction and welcoming to Maharashtra Mandal. And I really appreciate everyone, Chaya and Samruddhi and Vaishali and whoever all came and made me, special. You always deal with complex patients, but being around with community and helping them with the upcoming events is always a pleasure and a fortune. And I always appreciate this type of interaction. I like to be around community. Okay, thank you. So who is running the slides?
I'll run.
Okay.
Whenever you are ready.
Yeah, you can start the slide, the first slide, whatever it is there. Yeah, you can go back and so as you know, the big game is coming. Now Kansas City is hosting the whole world this summer. So we have to be ready for the, how there's a wedding in the home or wedding in the house, how anxious and how excited you will be. So probably we are all excited like that. Okay, next slide. So Samruddhi told me to kind of talk about what I do as an infectious disease specialist, and or what in general infectious disease specialist will do. In India, you don't see this specialty that often, or maybe not even now. Only some big city cities, they may have this specialization, but it is well known specialty in the United States for last several years. It's sometimes under-recognized also, but again, they do a lot of work. Probably after the COVID, the importance of infectious disease and became more, again, which we don't want in a wrong way, but they do good things and they help a community and the whole hospital and institution. So as infectious disease specialist, they work in two types of areas. One is like academic institutions where you see the university hospitals. They pretty much teach the residents, fellows, and they train new fellows to become full-fledged practice. That's how I came to Kansas City to do my fellowship in University of Kansas, and then you can either join in the same institution depending upon the need and your interest, or you work in community-based setting. That's the second type of work. As infectious disease you do, it's community-based hospitals. You see all these HCA related and St. Luke's related hospitals. They are basically community-based hospitals. They may have teaching resident programs, not on a full-fledged how academic institution will have, but their patients, you are involved in the patient care in those areas. This is the too broad where the infectious disease specialist work. In the next slide. So again, what is the role of infectious disease specialist? So they, first of all, seeing the patients is their role. Not much procedures, how you look into cardiology or interventional cardiology or surgery. They have some focused surgeries done, but infectious disease basically non-procedure oriented specialty. They involve in direct patient care, and the patients, they are involved mainly skin infections, soft tissue infections, pneumonia, joint infections, a heart or meningitis, although that is where you see the patients who are admitted to these hospitals, and then you are involved in their care, and when they're ready for discharge, you come up with a treatment plan. The second is infection prevention is the main role. You try to prevent infection anywhere, like by implementing certain measures like only contact or droplet precautions or any other type of precautions. You come up with your knowledge and also all the literature and data. You try to come up with prevention plan. And the antimicrobial stewardship, which is also a key. Using antibiotic when you need is crucial, and stopping them also very crucial. So they come up with plans how long you take and when to stop. Otherwise, I always tell my patients, antibiotics is like your bank. You don't want to withdraw your bank all the time, so you want to save it. So if you save your antibiotic, it is used for your future. It means you advocate patients, you educate family when they need, when they don't need. That is one important role of infectious disease specialist. And again, the other one is public health response. Now, with the recent COVID-19, how we have come across the new virus and how the public health is more important, and they are involved in those areas. And similarly, the pandemic preparedness and response, the infectious disease specialists circulate any important information in the community, like the health department closely associated with the infectious disease specialist, and also in the hospital, you try to communicate what is, the threat or what is the safetiness, everything. The other one, like in this outpatient management, what you see, again, people who come to the hospital, they go home, then they will need to know what to expect. And some people go home on IV antibiotics, some go with pills, and some with no antibiotics, and follow up with their workup to see what exactly they need. So we try to reduce their hospitalization duration and follow them and come up with good plans as a general or maintenance of their health and everything. Next slide. And feel free to stop me anywhere, if you have any questions that will help to address. That way I'm not just talking and you forget what is your question. I don't mind at all if you stop a little bit in between, but we don't want to again lose the time. I have few more important slides where we get into. So again, this slide pretty much said whatever I said, antimicrobial selection, dose, duration, infection prevention, and surveillance and outbreak investigation. Okay, next slide.
Oops.
So now coming to our key topic here. The World Cup, it's a big scale event. We are expecting around 650,000 plus visitors. So this is some data what I came across maybe a week ago when I'm making this topic. So the number may have changed. They're updating, and there are 104 nations we are expecting, and 4 cities are coming across almost across the North America. And there are like 5 matches, I think 5+ matches are planned in Arrowhead Stadium. And we are just a week into our actual event kickoffs happening. And again, Kansas City is the smallest host city, and this is the biggest opportunity. I think that will help us out. For a good economic turnout. But again, it's very big responsibility. He's in front. I think it's already started, and ahead we have next few weeks and couple of months. Maybe after that also you have a lot of big responsibility to follow up on the event and post event, whatever happens. Next slide. So, what is happening here? What do you expect with mass gatherings? Why you are worried about it? Because you are getting lot of countries in one place. So, each country is unique in their own situation, and each visitor will bring his own disease environment or everything. So think of, we are in northern hemisphere, the southern hemisphere at the same time will have a respiratory season for them. So we have to be very careful when we are thinking whatever the exposed patient or exposed individuals of what are they are up to and what we can get. Same thing with the food and water. Mass gatherings will have a lot of food options, vendors, and there are shared water resources and a lot of outdoor eating, and all this can pose us, foodborne or waterborne illness. And again, living environment now, the hotels are crowded, and there are short-term rentals, the Airbnb, and we don't know how are the shared accommodations. So that can concentrate people. And what happens again when there is a density, it amplifies whatever the illness, especially with the droplet viruses like influenza and measles. They can spread really very fast. Again, the mobility, what happens? Some people are coming from out of town and they go back to their hometown, so they can carry this same outbreak really if it happens, and they can take it with them. So it becomes very fast problem both nationally or internationally if something has to happen. So getting a good information or a reliable information from a reliable source is always important than getting a misinformation. So your primary doctor, your urgent care, or your local hospital sometimes are the right persons to seek help. Next slide. I think yes. So again, there are different color zones that we chose. Again, measles is the biggest immediate concern, because in the last few months, that is an emerging situation in United States, and again, almost 33 states as early as 2026, we have so many cases, and it is the most contagious virus, and one infected person can expose up to 9 out of 10 unvaccinated contacts. So who are not vaccinated or under vaccinated are really at a risk. Similarly, influenza A, we are in summer, but we can expect a southern hemisphere patient from winter, and also novel viruses like H1N1, bird flu, all those. But again, some of them are human to human transmission is rare. It's not yet confirmed. Sometimes but we have to be vigilant. So seasonal flu vaccine, if you have received, then you are at least protected. Similarly, other things we have to think of is monkeypox, because of recent emerging problem and new clades of illness, and again new sexual partners with close interactions. Again, there's a vaccine available. So this is like a three common viruses we have to be aware of, and luckily we have vaccines for all these three, and in having an information on this is always important. Next slide. So again, mosquito-borne illness, we should not forget. Again, summer month, you'll be staying outside. Um, so dengue, chikungunya are not here, but they can come from other, the travels, and they can they are sometimes endemic in some regions of like South America and Asia and other Caribbean. So you have to keep in mind. So that is again, those viruses, those mosquitoes are not endemic here, but still we have to keep in mind. And again, food and waterborne, I don't want to go more and more, but again, you have to make sure that you eat from reliable vendor, and again, heat accelerates the bacterial growth. So make sure that you don't want to eat any raw or undercooked items, or wash your hands before eating. And always the public health experts worry about a disease X. You never know. And any impending or unknown pathogen is coming that is called as disease X. So we have to have strong surveillance systems and personal hygiene. And so always look for something, don't try to ignore anything. Again, so the antimicrobial resistance is also one thing. So don't share anyone's medications, and make sure that knowing their travel area, like their country, and common drug resistant bacteria. But again, with this little bit of less time of duration, antimicrobial, like I mean, bacterial infection probably are less, but again, you have to remember them. Next slide. So again, this is the same information on the measles. As we said, it's the hot concern. And again, it is unvaccinated people, they can get the virus because of the infectivity. And again, if it is a community vaccination, that makes it like the disease won't, uh, it will be prevented, it won't spread. But however, there are some gaps of unvaccinated people is the cause for those outbreaks. So we have to remember that. And again, this virus can survive in the air almost 2 hours after a person leaves the room. And again, 100 plus countries are coming with some other countries compared to United States. They have low vaccination rates. So that we have to remember that. And also, who will help you in this? Your primary doctor can check your MMR vaccination status and see whether you are up to date with your immunization or not. Next slide. So again, personal hygiene, again, not to say twice, thrice. So wash your hands, and wash for 20 seconds, and especially before eating and after using restrooms, or and again, high touch areas like railings, all these doorknobs, and again, those are all the points where you can get get the viruses. And using a hand sanitizer always is a very big backup for you when you have no immediate water source available to wash hands. And again, cover your cough, and especially they educate you not with your hand, because you can again transmit a virus more. And, use your elbow, but watch for any warning signs, and be aware of your surroundings. Do know your exits, and look for ventilated spaces than the enclosed ones. And again, don't share your drinks and utensils. When you are in a excited mode of game, you never know what you are exactly doing, but be vigilant, because the respiratory and by GI illnesses can spread by sharing these things. Again, go to the next slide. Yeah, thank you. So what are the areas where you have to seek help? Now we are in the big summer month. It's a very hot and humid in Kansas City area. You have to make sure that you hydrate yourself. And one thing again, alcohol runs along with the big game time, but it can cause you more dehydration. And look for your other signs of heat exhaustion. Like how you get sweating, weakness, dizziness. You want to look for those. And again, there are some other resources which I will be telling in my next slides. Go to those websites to get alerts. and see what is safe for you. And again, when to seek help is always important. Again, with fevers, rash, vomiting, difficulty breathing, you want to know that you have to go for help. Next slide. So now the other thing is, not only you take care of yourself, then you have to take care of your home, you have to take care of your neighborhood. So you have to look for things. If you are hosting guests, then you know where they are coming from. Make sure that they have good, proper place to stay. And again, don't share. And if you are if you have a plan for hosting a guest, and also if he becomes ill, make sure that you have all the information of the guests, and also provide them the nearest urgent care. And you vaccinate your household with all the vaccines, whatever you think of. And again, if you are sick, stay home. And again, hand hygiene, all these things to be always kept in mind. So when you take care of your home, then whom else you take care of your community. So look for your vulnerable neighbors, elderly residents at home and immunocompromised people. They're all need to be watched more carefully, and watch for warning symptoms. And you have to seek care right away. And again, all the facts what you want to go is from the reliable websites, like KDHE is the Kansas Department Health and Environment, and Missouri has their Department of Health for senior citizens. And so they have good websites, reliable things are updated there, and want to go there and look for what are the updates. And CDC. And but any misinformation is not advisable, because sometimes it creates panic. Again, it spreads more faster than a virus, any panic in the community. And again, we want to welcome the visitors. Don't be afraid that, oh, they're from some other country. Again, you know that they may get some viruses, but be more approachable. And again, look for friendly environment, but don't be panic, don't be fearful, but know what to do exactly. Again, sign up for these health alerts from all these websites. Next slide. So again, what to do when you're sick, and this is a common thing. And again, these slides are available again to you to look later. So again, what all the warning signs you have to look. Again, ERs, again, we are worried. Even as a physicians, we are worried that the ER will be full. Or so try to kind of see where your symptoms will fit in. Again, urgent care is also a reliable resource when your symptoms are not that bad. The blue symptoms are milder, and the red symptoms are severe. And again, calling any healthcare person before you seek help will help. They can at least they tell you, hey, come to the place, or just stay home and do these things. Get telling them always helps. Again, getting a travel history also. Again, as physicians, we are trying to make sure that when they're doing triage, the travel history is updated. That way, And again, stay home when you're sick, and don't go to public places until you're fever free for more than 24 hours without any medication. So this will protect your community. Next slide. So again, summer month. So what you have to look for, what are the heat safety? Look for heat exhaustion, and there are level of heat exhaustion symptoms, and heat stroke is an emergency where you see higher fever. So you have to call 911 immediately, because it is life threatening. And especially elderly adults and children and people with heart problems and other disease conditions, they're more vulnerable. And keep water always reach to, like, have water source accessible to you right away. And again, clothing should be very friendly to the environment. And finding a shade, and avoiding some heat times. But again, the match timings I don't again keep a track. But try to avoid that like a high heat timings. And again, never leave anyone in a parked car. You never know how high those temperatures will go. And again, when you are in a big crowd or in a big auditorium or a stadium, see what is the safety, like know your exits, see where you have to meet. And so when there's a crowded environment and everyone is trying to get out at the same time, there's always danger for compression. And try to stay towards the edge, that way you're not in the center and get crushed. um, Again, alcohol for that, trace, don't go too much impairment in the judgment. So staying sober, and also it helps to manage any situation in a proper way than in a dangerous way. So that is what important. Again, mental illness, again, when a big event is coming, sometimes fatigue can happen. If you're really watching games during late nights, again, you feel tired, not rested well enough. So that can cause anxiety. So make sure that you rest enough. And again, when you are in a crowded environment, try to make sure that you are safe and know your exits. And again, anxiety related to health is always, but again, trust the reliable resources. And again, reach out to right places when there are several crisis lines. Someone may talk it into the situation and manage the situation better. So know when to seek help. Okay, next slide. So again, these are the three things. Again, I mean, mumps, measles, and rubella vaccination. That's one important thing to cover, to protect against measles, and the seasonal influenza vaccine, and also COVID-19. Not to forget about it. Again, who are all eligible for the booster? Try to take the booster. That way, you are protected. Next slide. So, again, trusted resources. We have been talking about all these. So, the KDHE, Missouri Health Department, CDC, WHO, and your primary care doctor, and health public information helpline. So again, we don't want to have a misinformation. So what happens is misinformation is the toppest global threat. um, Again, there is a lot of misinformation about the vaccines, and that makes not to take the right thing, and ignore and put people at risk, put yourself at risk, and put more people also at risk. So so again, this World Cup may generate several rumors, so be prepared. Don't try to go to false alarms, and try to stay calm and go to the right place where you need the right help. Next line. My next slide. So, what Kansas City is doing for you, and what is your responsibility in this situation? As I said, there are several health department websites trying to create communication and alerts, and they are trying to train the healthcare providers what to look for. That way, you are on top of travel related illnesses and rare illnesses. And there is again wastewater monitoring, so they keep a close eye on the wastewater, and the surveillance tells us what is coming into our area. They try to look what new viruses or what kind of prompted in the wastewater. That gives a lot of information ahead of time. Again, there's dashboard that is kind of actively in process to help the physicians to look for country specific disease risks. CDC has a good resource. When you put the name of the country, they will try to tell you what all the things you look for. Again, now we are twin states, like both Kansas and Missouri are trying to coordinate with each other to host this big event. So that's the Kansas and that's what in the KC area happening. So now what is your role to make sure that you take your vaccine and take care of your hand hygiene, and especially in all the events and also in the public areas, know what is the health department websites and what are they providing you, and stay home if you're sick, and no game is worth watching at home when you're really sick. You don't want to spread the illness. And again, go to the reliable health information and try to educate yourself and also educate community in a nice way. And also check neighbors or elderly who are sick. That way you can help them in right time. Next slide. So basically the takeaway points, you can look at those. So be aware of what is good for you, what is right for you, and trust your doctor, and look all the verified websites. And there are, again, on the right side, I provided some of the websites. And I think for Chaya, I gave some flyers. So again, feel free to read them at your convenience when the time permits. So doctors are working for you and community is working for you. So when you do your duty, you'll be in safe hands. Okay. I think this is my last slide. I don't know.
Yeah, this is the last one.
Okay.
Yep.
So
Thank
I'm
Mhm.
open for any questions, but again, as I said, this is the weekday, and if no one has any questions, and feel free to them to look at the presentation and hear the presentation, and again reach. Samruddhi is more knowledgeable. I think she has been doing lot of research, and she provided me so much information even beforehand. So she's proactive. So I think everyone is proactive. Chaya, she has been so good to reach us, and all the committee members are welcoming me to share. But we don't want to make anyone anxious, but be comfortable, enjoy the big event, and hopefully we'll have it good. No panic things. And I think hantavirus came on last week. I think I did not cover, but it's mainly in the closed spaces, rat-borne, so I won't be worried. I'm more worried about the measles and flu, than and foodborne and waterborne viral illnesses, and something like Ebola, Hanta are specifically located to some parts of the country, world. Um, I don't want to panic on those illnesses first than the common ones. Common is common.
Thank you so much, Dr. Bala. This information is really, really helpful for, I would say, for every resident who resides in Kansas. Yeah, I mean, everyone should know what the precaution they have to take and how to react if something happens. Thank you so much. So,
Dr. Somayaji.
and again, I would like to really thanks to Samruddhi also. Yeah, she is since day one when I talked to her, and since day one she is communicating with you, me, to figure out what are the topics that we need to discuss and how that would be helpful for our community.
I think thank you so much, Dr. Somayaji. This is not a very popular topic. We know that, but Kansas City hosting the FIFA World Cup was just a reason. The more important thing to do here was introduce the community to what is infectious disease. I bet nobody knows about that, or barely anyone knows about that. She is a doctor. Dr. Somayaji is a doctor you hope you never need. And
yes. I don't mind when I don't see my patient. Okay, hope you don't need me.
Exactly.
That's what I say.
Everything is going well.
So this was the purpose of having the information is very readily available on the internet. It's about how you put it together and the resources that you provided. And it was important because 650,000 visitors coming from across the world, but the population of Kansas City is only 500,000. So if the number is true, then we have a very large mix of people coming here. And given that some of us may be volunteering there, some of us may be attending the matches in person, and we have elderly parents coming here during summer vacation, all of that matters for our parents' health as well. And it was important to know when to panic, when not to panic, and who to follow and who not to follow. So again, thank you so much for doing all of that and putting everything together.
Yeah, the presentation is really informative.
Thank you.
Okay, we can take our questions. So, Vaishali.
Hello. Thank you for the very helpful session, doctor. I have a question. Like, we took the COVID booster vaccine 2 years back. So do we need to take it again? Like, is it a yearly we need to take it?
So again, vulnerable patients take it. So what I pretty much said, if you are traveling to India, try to make sure that you are, again, 2 years ago, you have to take in booster. You may not have any immunity. So if you're traveling and you're making yourself exposed to different in a population, then better to take the booster. But again, if you are not immunocompromised, not above 65 years, I don't 100% volunteer to take. But if you are planning to go to match, when you expect other people, you can be exposed, then you want to be vaccinated. But you can say, oh, I'm not going to go to the match. But again, the same person who was in the match can be your person next to your Walmart who is checking up, So taking but you had problems with the vaccine last time, you did not do well. Oh, I hear all this. Oh, I felt so tired after the vaccine. Then I will think twice. But you can always check with your primary doctor, and who knows your illness more than me. But I will suggest to be immunized against flu. Again, our flu vaccine is only from February to October to February. So we already crossed that. I won't recommend them to take another vaccine thinking that a southern hemisphere influenza illness going on patient will come here, so you take another flu vaccine. Now, I won't suggest, but if you had been vaccinated for your flu season, you're good. But for COVID-19 also, I think yearly it may become like a flu at some point. Yearly is recommended. But you can check with your primary, but I'll suggest you to take if it is about more than 2 years ago.
Okay, thank you.
Okay, we'll take next question. Pratap.
Hey, Dr. Bala. Firstly, thank you for doing this session. Highly appreciated. My question is around the temperature. So there was a slide that said 104, up to 104, you can go to urgent care. After that, you go to the ER.
Yeah.
But on the next slide, it was if you're at 103, then it's a life-threatening situation. So a little bit confusing to me which one it is.
Again, you will look into other symptoms also. Again, if you just have a high fever but no other warning signs, you can still take Tylenol and talk to the urgent care and see. But again, the heat exhaustion, heat hyperpyrexia, those are the things which are life-threatening because of the summer weather,
Right.
So,
And my next question is also related to dehydration. So we know, of course, summer season, most of us want to be outside. What is the quickest remedy if we feel that we are dehydrated?
Again, having water available always is important. Liquid IV, when you go to the Costco, you see all this liquid IV, and those are all the good resources. So to get a quick clarification on your question, so what are the good resources you're asking?
No, like a quick remedy. Like if somebody would ask me, I would say have Pedialyte packets in a bottle of water. Mix those, and anybody can drink it, from kids to grown-ups to older people. So is that a good option?
Yeah, because when you lose water in the form of a sweat, you lose salt also. So if you are replacing with only plain water, you're not replacing your sodium, But the
Right.
Pedialyte has all the electrolytes which are kind of balanced with your fluid electrolyte loss. But if you're thirsty, you're trying to keep yourself hydrated, water is the best source to keep your thirst. But
Okay.
yeah, when you drink with Pedialyte, I don't think the Pedialyte mixed with water takes away your thirst that well. Again, I never drank like that, but eh, advantage of Pedialyte with water is you have all the electrolytes. But again, I've seen liquid IV has all these electrolytes, pure water, so many things are available. But again, having some source of, especially caffeine causes dehydration, alcohol causes dehydration. So avoiding those to replace your water than water itself is ideal. But if you are replacing with some amount of salt and some amount of sugar, what the ideal thing is, your lemon water or what you squeeze with salt and again, what is perishable, what you can drink easily, that's what, and having that available to you right away. So I don't have any problem if you mix Pedialyte and take water, that we are making sure that you have enough sodium, potassium, all the other electrolytes, what you are losing in the form of a sweat. Is that helping you? Is that clear?
Yes, yes, it does help.
Again, when I'm giving IV fluids, I will look into half saline, half normal saline. I'll be checking sodium, potassium. That's how as a physician level. But at
Right.
a ground level, you want to make sure that if you are losing in the form of a sweat, you don't want to replace only with water, but you want to have some amount of electrolytes in some way.
Yep. Thanks, doctor.
Mhm.
Okay, I have two questions, doctor. Okay, I'll ask somebody to go first, and then I'll ask my questions. And somebody, please go ahead.
Yes, actually not a question, but I think this session may be recorded. If it is, then we have a lot of elderly population in our community that may be listening to this and following your guidelines. So if you have anything specific for population about the age of 55, 60, or 65 years, please give them some guidelines too.
So the thing comes for vaccine, that the main question is for the vaccine. So for any individual more than 65 years of age, if they are immunocompromised, irrespective of immunocompromised status, you'll recommend influenza and the COVID-19, and they should be up to date with MMR vaccine. So the other population, again, flu vaccine is a little bit mandatory. That is helpful because if, again, if you're a healthcare person, you definitely get your flu shot. But if you're not healthcare person, you try to take it or not take it. But if there are a lot of people vaccinated and you are not vaccinated, then your chance of getting the infection is high. So that's why you want to vaccinate yourself. That way, you reduce your chance of infection. It's irrespective of age, what I'm saying, for the flu. And you should take MMR vaccine. You have to check your status to see whether you are up to date in your MMR vaccination. So there are mainly 3 different vaccines are coming into play for viral illness now is COVID, influenza, and MMR. So again, people who are coming from other countries or they're visiting, I would suggest them to have up to date in their flu shot. And if they're more than, again, 55 or any other immunocompromised condition, check the pneumonia vaccine recommendations and Tdap. Those are all the basic vaccination things which they need to have. Is it helping
Yes,
somebody?
yes, thank
But
you,
I can,
thank you.
there are, when you look into vaccine recommendations, there is specific guidelines for number of doses and everything. That will be more specific to each person. So again, I don't want to tell her in a broad way, but these are the 3 vaccines I will definitely recommend.
Right. Thank you so much. This is the kind of information I was hoping for you to share. Thank you.
And is this the same list, Dr. Bala, that adults also has to follow for vaccines? So COVID, flu. Uh,
Flu is, again, as I said, the flu vaccine is indicated for everyone, but sometimes the awareness is like that. Oh, I'm not a healthcare person. For who, like for me, Samriddhi, we are in hospitals, so flu has been mandatory for quite some time. So, but for other people, it's not mandatory. But when you don't get it, you become vulnerable. So we recommend flu vaccine, up to date flu vaccine for you. Yearly flu vaccine is recommended
okay. So are there
unless you have any side effect like allergies, like egg allergy. They have that egg allergy or hypersensitivity and all those things.
got it? So are there any specific list of vaccines that we have to take, like not the healthcare people, but the people like us?
Yeah, there is maybe in the CDC you will have, or up to date, or again, I can share those slide wise, for the vaccines that are recommended. But your healthcare provider can have it, but maybe they are not able to provide, since I'm giving the topic, and I can share those slides for everyone.
Mm-hmm.
What all the vaccines, with the age breakdown for the children and also for the adults.
Okay, perfect. And my next question is, so basically we know that on the event day or on the game day, we are expecting multiple people in our Kansas City. So do we have to take any extra or special precaution when you are actually watching the game on the game day in the stadium?
Again, make sure that no one is around. You are sick, someone is actually coughing. You ought to keep an eye and keep some space. And again, know your exits, and cover your cough. Or you want to wear a mask, that's not a bad idea. That way, you will reduce the chance of your exposure to other people's infection. So, and be careful about the food and water source what you consume. Um,
Best way to avoid outside food, at least on the game day.
um, but again, yeah, again, but reliable vendor, trusted vendor, you want to, but so many things. Again, how much you can avoid. If you're going there, you end up, kids will be asking something, but be careful.
Okay, that's true. Thank you so much.
Mhm.
Okay, if no one has any questions, then I think we are good to end up this session. Thank you so much, Dr. Bala. We'll post this recording on our MMKC YouTube channel, as well as we'll post it on our WhatsApp group as well. Along with that, I know that you have shared 2 more flyers, or one more document, and another one is list of the help centers where we can approach. So we'll upload those documents as well.
And about the vaccination, I will definitely share what all the mandatory vaccinations, irrespective of what is your profession. Again, you take it or not, but your healthcare provider has to recommend, and that's how we follow. And again, having that information in this website, I think that's a good idea when we are talking about the vaccines that are needed for anyone.
Okay. Thank you so much, Dr. Bala, and thank you everyone for joining this session.
Thank you, Chai and
Have a
thank you,
good night.
Dr.
Okay, thanks for having me, and I enjoyed talking few minutes with you. Okay, take care, huh?
Thank
And
you.
go again. I don't know. Go FIFA. That's what.
Yes, I'm
Okay.
going.
Okay.
Okay. Thank you, everyone.
Bye-bye.
Bye.